Hi, before we get started on this physical exam, I want to explain that I've washed my hands in hot water and soap and use soap, and this is important to prevent infection. So this is a very important first step. Hello, Mr. Clausen.
Hello, ma'am.
My name is Joyce Myers. I'm a registered nurse, and we're going to do a brief physical exam today, if that's okay with you. It will take about 20 to 25 minutes, and it's okay to ask questions if you have questions, and anything that you say or any findings that we get are confidential. And are you okay with the privacy?
Yes, ma'am. Yes,
Are we
ma'am.
private enough? Okay. Earlier, we assessed his vital signs and found that his blood pressure was 122/79. Pulse was a radial pulse of 78. It was regular. His respirations are even and unlabored at 18, and he had an oral temp of 98.1. These are all within normal limits for this patient. Now, Mr. Clausen, I'm going to give you 3 words to remember, and throughout the exam, I'm going to bring them up periodically, okay? The words are potato, book, and candle, all right? Okay. First of all, let's take a look at his skin. It looks to be, it's warm, dry, intact, and he has multiple tattoos. There does not appear to be any lumps or tenderness present. His skull is normocephalic. There's no lumps, no bumps. His scalp is pink without lesions. And I don't see any parasites or nits in his hair. It's fine in texture and light brown. His face is uniform in color, although we can't tell under the facial hair. But what we do see is uniform in color, and his features are symmetrical. Now I'm going to have you close your eyes. Okay, you take your glasses off. This is to test the trigeminal nerve. I'm going to touch his place on your face or your cheek or chin or somewhere, and I want you to tell me when you feel it and where. Okay?
Right on my cheekbone, on my chin, my forehead.
Okay. All right. All right. We see no drooping. We see no drooping. And can you smile big for me? Oh, more like a grimace. Okay. Bare your teeth. His facial expressions are symmetrical. And I want you to try, I'm going to remove your glasses here. I want you to try to close your eyes and try to keep them closed while I try to open them. Ready? There we go. And this has been a test of his facial nerves. I could not open his eyes. Let me see your hands, your arms and your hands. Okay. Skin is smooth. Your nails are convex, trimmed, translucent. There's no clubbing. Capillary refill is good in this hand. It's less than 3 seconds. Good here. And you have shoes on you. Okay. Capillary refill is less than 3 seconds on that side. And on his left foot. Okay. All right. His eyelashes are thick and evenly distributed with no scaliness. We're going to test several nerves out here: the optic nerve, the oculomotor nerve, the trochlear nerve, and the abducens. Okay. If I had an ophthalmoscope, I would be looking into his eye, and probably see a bright pinkish red area through his pupil. And in this area, we find the optic nerve, which is to be a creamy white disc. And from this disc, vessels are paired, and they go off in 4 different directions. Now I'm going to turn the light off briefly, and we're going to check his pupillary reaction. Okay. Mr. Fossum does wear corrective lens, so we know that we're going to let him do the Snellen test with his glasses on. We have a Snellen chart, which is 10 feet away from us in that direction. If you will cover your right eye and read the smallest line you can with your left.
LFT, LFTC, DFCY.
Okay, I think you got 5 of those. I'll try it with the other eye.
Alright, LEFCD, PCT.
Okay, you got the 20/20 on that side, but your right eye appears to be a little weaker. But with your corrective lenses, what is the smallest line you can read?
I thought we just did the.
Well, that was with each eye. This is together. Both eyes. Just looking at it with the corrective lens.
DEFPOTIC.
Okay, that's the 20/20 line on this chart for 10 feet. So we can say that his pupils were equal, round, reacted to light, and to accommodation. All right, the 3 words. What are your 3 words that I'll ask you to remember?
Candle, book, tailor.
Very good. Excellent. Let's take a look at your ears. All right, his ears are symmetrical, warm, elastic with the immediate recoil. He has piercings in both both lobes. If I look into the outer ear canal, we can see that it is clear with just a small amount of cerebrum. And the same can be said for this side. So his ears are clear. Okay. I'm going to stand 2 feet away from you, and I want you to cover one ear at a time, and I'm going to whisper a 2-syllable word. Okay? So cover, push that in. Okay.
Uncle.
Oh, very good. Very good. Now let's try it from this side. Different word.
Apple.
Very good. All right. All right. If I had an otoscope, I could visualize his ear canal and tympanic membrane, which is the eardrum, and it would most likely be pearly gray. And if we were lucky, we might be able to also see the incus and the malleus. And we just checked his vestibulocochlear nerve by doing the whispering. Okay, let's take a look at Mr. Fossum's nose. There is no obvious deviation. We need to check his sinuses, and I would do that by gently pressing, or actually pretty firmly pressing, the frontal sinuses and here the maxillary sinuses, and we tap them, and we tap here. Do you feel any pain from that?
No, ma'am.
Okay, so Of his mouth, we can say that his lips are pink and moist and symmetrical without cracking or lesions. Uh, Open your mouth a little bit, sir. His teeth are all present, white. There are no appliances, oral appliances. There's no bleeding or lesions on his gums. His hard and soft palate are continuous. Okay. Now, we need you to say, ah.
Ah.
Okay, now say, ah.
Ah.
Okay. We're testing the vagus nerve here, and that is, it's moving up and down with phonation. So, on the glossopharyngeal nerve, we take a look at both sides of his tongue. The dorsal side is pink and rough and moistened. The ventral side is smooth, moist, and has veins, and there is saliva present. Now, the hypoglossal nerve will test by having you stick your tongue out. Okay, this tongue comes out, it comes out at midline, and that's all we need to look at with that particular nerve. On his neck, the skin is light tan, continuous with the visual part of his face. The trapezius sternomastoid muscles are strong. I want you to shrug. Okay. And the spinal accessory nerves intact. I want you to push against my hand on this side. Now I want you to push against my hand on this side. Okay. As far as the skin goes, there are no scars or lesions. You can do a full range of motions. Put your chin to your chest, sir. Okay, now I want you to turn your head to the right, turn your head to the left, tip your head to the right, tip your head to the left, then tip it back. Okay. There are no, we're going to check for lymph nodes now. Okay. So we start out here in front of the ears, and we go from there to behind the ears. Okay, and down to the occipital area of his head. Then we're going to try under his jaw, the tonsillar area, and the deep clavicle, or supraclavicle. Okay? I'm going to palpate his carotid arteries. Now I'm going to listen to them. All right. Okay. All right. There are no bruits. It was strong, regular, and rhythm. So your carotids sound pretty good. Now let's take a look at the thorax and lungs. His spine appears to be midline. We have the notch here for C7. We're going to palpate for lumps, pain, tactile frenitus. Okay, are you having any tenderness?
No.
Okay. I want you to breathe deeply through your mouth. Go ahead. Okay. In his upper back region, we find that the sounds were vesicular. I'm going to listen to the tracheal and the bronchial areas now on the anterior. On the tracheal area, we find that it is bronchial sounds that we hear. And out, out. Pretty quiet in the bases. Okay. All right, we can say that his breath sounds are clear to auscultation with no adventitious sounds heard. Okay, we're going to check expansion. Take a deep breath. Now, pull it back out. This can also be done from the back as well. Okay? Now, I need to talk about breast exams, which Mr. Clausen is not going to get a breast exam. But whenever you're doing a breast exam, you check for color and no increased vascularity or lesions. We want to see that the nipples are darker in color and everted. We look for symmetry in the breast, no masses, edema, dimpling, or retractions. There are three basic positions for checking a breast patient's breast. Arms overhead, pushing hands into the hips, and pushing your palms together. If the patient has large pendulous breasts, she may lean forward while the forearms are supported by a healthcare worker. We also palpate the axillary nodes, the lateral, central, posterior, and anterior. And there are three ways to palpate the breast for lumps and any unusual feeling, bumps, or anyway, vertical stripe, straight up and down on the breast, on down each breast. Then you have the wheel spokes, which comes from the nipple out. And then you have circular, which begins at the nipple and works its way around. You pinch the breast, the nipple, and check for discharge. We will want any axillary nodes palpable, or we don't want tenderness or nipple discharge. Mr. Clausen is alert and oriented to person, place, and time. He has been pleasant and cooperative. There have been no speech difficulties, and he's had an appropriate attention span. And now, for the last time, he's going to recall the three words.
Candle book Taylor.
Okay. That concludes our exam. Thank you.